Dr. Fankhauser, let's talk about veneers, which are those little clip-ons on your teeth, like a fingernail, for ladies to make the tooth look nice. And let's talk about that one word which is called Lumineers, which is out there. And most of us are confused what is what and when should one be done and what is better when.
What is better when? Okay, the difference between the Lumineers and regular veneers is that with the Lumineers there is no reduction or reducing of the tooth surface or cutting away of the tooth. Okay, with regular veneers, a small layer, a thin layer of the enamel is removed and then it's covered back with the veneers. Okay, and actually, it's my opinion, that works better because, you can't put two things in the same place at the same time. So if you just put some Lumineers on over the teeth, they're going to be a little bit thicker or bulkier than if you remove something and then replace it with something, see? So you have much more control over the aesthetics and the shaping if you prepare the teeth and make the veneers more artistically shaped, let's say.
I see. What's the story about grinding down the tooth, which is what removing a little bit of a millimeter or whatever it might be from the surface is what that is. Does that hurt the tooth? Some advocates might say, well, that hurts the tooth, and why grind a perfectly good tooth if you don't have to? What's the deal on that?
Well, if you want the veneers, then there's obviously something wrong with the tooth in the first place.
That makes sense.
If you don't want to grind on your teeth in order to make them look nice, then we have a different solution. It's called orthodontics or Invisalign treatment. We do that to reposition the teeth to make them look like they're supposed to. I like that option a lot better than grinding them down and putting veneers on. So that can be done a lot of times in a year or less, and it's very easy to do. There's most of the time people don't even know you have anything on your teeth. So, but with Lumineers, you're going to have teeth that may look nicer than they did before, because it depends on how crooked they were or why you were doing it. But they're never going to look as good as if you do a good set of prepared veneers.
I understand. Okay, I understand. And obviously, since you mentioned to me that you cannot put two things in one space, basically if a tooth is a certain size, no matter how thin that Lumineer is, which goes over, the tooth becomes bigger. So I think it's going to be very difficult to only do one tooth if one tooth has a problem, because that tooth would probably, look probably like a rock on the beach or something like that.
Yeah, well, sort of. Yeah, you would have to do several of them together to make it look okay.
When you get rid of the veneer, because you grind it down, you might get away with just fixing one if one tooth had a problem, right?
Yes.
Okay, I got it. All right, wonderful. Well, thanks a lot. We're going to talk more about different options on how to make teeth looking good, such as maybe ortho. You're welcome.